patient, please.
Newham Hospital in London's East End this morning, running as normal. Tomorrow, not so much. Although right now they have no idea how many of their resident doctors, formerly known as junior doctors, will walk out on strike.
Without resident doctors, it means that we have other members of the team, consultants, specialist nurses, pharmacists, therapists, having to do roles that they wouldn't ordinarily do. We've been incredibly lucky to this point that people have stepped forward and stepped up and are providing that cover to allow us to provide care, but it does mean that there will be some knock-on for some of our patients with elective care.
The true numbers take time to come through, but some operations and procedures in trusts and GP surgeries across England have been cancelled. And for staff, holidays postponed, all they say, to minimise disruption. The quip is that patients actually get to see the most senior doctors while the residents are on the picket lines. But NHS England insists safety is at risk.
It is very disappointing that we've got to this point and we have a period of strikes. They're extremely challenging situations for everybody, and I really hope that they get back to the table and we find a resolution to avert the strikes.
After talks between the Health Secretary Wes Streeting and the BMA resident doctors leaders last Thursday, there was a glimmer of hope the strike could be postponed. Even as recently as Tuesday, the signs looked good, but it was not to be. If there was any goodwill during the negotiations last week, well, that has gone completely out the window. The government is quite frankly furious with the BMA, saying that they have acted in bad faith, while the BMA says the government didn't put anything substantive on the table, so they had no choice but to go ahead with the strike. There is considerable dispute over how much resident doctors' pay has actually fallen. The BMA is asking for 29%, which they say would bring them back to 2008-9 levels using the retail price index. The health think tank, the Nuffield Trust, says their pay has fallen by 4 to 10% since 2010-11, so considerably less, and they're using the consumer price index. But for 23-24 and 24-25, resident doctors received a 22% pay rise. And this year, doctors in England and Wales were awarded 5.4%.
Nobody has ever said that we want our pay restored all in one go. We're willing to be flexible, we're willing to be creative, we're willing to talk about things. The problem is that the talks that we had previous to this, all we got in response was no. No, we can't discuss pay. No, student loan reform is not on the table. No, we won't give you an offer in order to call off the strike.
Planning for strikes can take up to 2 weeks, but this is round 12 since March 23. So they tell me here that they're becoming well versed in how to manage the hospital with as little disruption as possible. It is no exaggeration, I think, that the government really were blindsided by the breakdown in these talks. And I've spoken to people who are in the know, and they said the same thing. They really thought they were going well, that they were constructive. But on Tuesday, it was not to be. Now, the government is adamant that there is no more money on the table, but they have said that they are more than willing to talk about conditions such as having to pay for the mandatory exams that resident doctors sit, or their rotas. The BMA, on the other hand, says, well, we were promised some of these condition changes after the last strikes, and they've just never appeared, so why should we believe them now? Now, the problem for the government, of course, is that there are other health unions out there who are already annoyed that the resident doctors had this 5.4% pay offer, which was by far the biggest, highest in the public sector. The nurses are already angry. There are indicative votes already going on out there about strike actions. The problem for the BMA is that the public is not in support of these strikes, by a very small majority, but they are not. And I'm getting the impression that maybe their colleagues aren't as willing to support them this time because it was a very big pay rise last time. In the middle, of course, are the patients, and we don't know how many operations and procedures will be cancelled, but as it goes on, of course, it is clear that patients will be affected.
Thanks, Victoria.
Well, joining me now is Rory Dayton from the NHS Confederation, an organisation which supports and speaks for the healthcare system in England, Wales and Northern Ireland. And he is director of its acute network. Thanks very much for joining us. The Health Secretary Wes Streeting called the decision to strike reckless and needless. The BMA say first-year residents are on £17.50 an hour and they can't manage. Where do you sit?
So we recognise that this is a staff group that's enormously important to the NHS, but it's also a staff group that received one of the largest pay rises in the NHS and also in the public sector over the last couple of years. The focus of NHS leaders is very much on the patient at the moment. The focus is on supporting patients as much as possible through this strike action, minimising the impact of this strike action. So I think we believe that the talks were going well, that there were options and genuine options on the table, and it's really disappointing that we've gone to strike action quite so quickly.
I mean, most people seem to be saying that the talks were going well. So what do you think went wrong? During negotiations last time, as Victoria said, doctors say promises were made about conditions which just never materialised. And that hasn't helped trust, has it?
I think that's a really fair point. And I think as this dispute develops, and there's a real hope from healthcare leaders that this can be resolved as quickly as possible. But as this dispute develops, I think the idea of pay is not on the table, and genuinely not on the table from the Secretary of State. The Secretary of State has been really clear on that right from the start. But there is a real willingness to open up other avenues and different issues around conditions. And I think there also is a recognition that NHS
but the doctors don't
been...
trust the government, do they now? They don't trust them after last time.
I think there's a recognition that, and I think the BMA makes a really fair point, that some of the things that were agreed last time weren't carried through. And I think there is a willingness and there's a level of honesty in the NHS and from NHS leaders that they really need to make things right. But there's also a level of honesty and reality that money just isn't on the table this time, that this group of, this part of the NHS workforce has been significantly prioritised over the last couple of years, and it's not going to happen again.
Just briefly, I mean, you're suggesting they're being a bit greedy here?
Not suggesting they're being greedy. What I'm suggesting is that there is tension. I think Victoria referenced it in her report, that there is some tension. A hospital is a community made up of a wide variety of different professions, and there is, some of our members are talking about tension that exists between the resident doctors and some of those other staff groups, and that really can't be allowed to continue. Some of the early indications we've got of tomorrow morning, and we really won't see what happens until 7 a.m. tomorrow morning, but some of the early indications suggest that perhaps the strike action isn't going to be as impactful as it has been previously. So the feelings of staff in hospitals, the potentially a reduced impact of strike action and a reduction in public support could all come together.
Just very briefly, sorry, because obviously, you know, the patients are really critical here. And I know you won't know until you see how many people do walk out. But in terms of contingency plans, how many operations and procedures have been or are likely to be cancelled?
Really impossible to tell at this point. We'll get a set of figures a week on Friday. That's when we'll get some sort of certainty at that point. What we know, and what we know from our members, is that the focus of the last week has been about providing a safe environment for patients to use the NHS. And sadly, as Victoria suggested, they've become very good at that over the last couple of years, about planning for risk and managing risk.
Rory Dayton, thank you very much for talking to us. Thank you.